Welcome to the Mayo Clinic Ophthalmology Podcast, brought to you by Mayo Clinic. I'm your co-host, Dr. Brittni Scruggs.
And I'm your co-host, Dr. Eric Bothun. We are here to bring you the latest and greatest in ophthalmology, medicine, and more.
Dr. Sophie Bakri is the chair of the Department of Ophthalmology here at Mayo Clinic. She joins us today to share takeaways from the recent annual meeting of the American Academy of Ophthalmology.
Dr. Sophie Bakri is the Macmillan Professor of Ophthalmology, a vitreoretinal surgeon, and the chair of the Department of Ophthalmology here at the Mayo Clinic. Dr. Bakri's research focuses on pharmacology for age-related macular degeneration, diabetic retinopathy, and venous occlusive disease. She is also principal investigator on numerous multi-center clinical trials on novel drugs for retinal disease. Dr. Bakri serves on editorial boards, including the American Journal of Ophthalmology, and serves as a current board member for the Association of University Professors of Ophthalmology and Women in Ophthalmology, and past board member of American Society of Retinal Specialists. She has won numerous awards recognizing her work in ophthalmology, and we are honored to have her not only as our chair, but sit down with us today and discuss the recent meeting of the American Academy of Ophthalmology. Welcome, Dr. Bakri.
Thank you, Eric, and thank you, Brittni, for having me today on the podcast.
Yeah, welcome. So first question. So you were the program director of the Retina Subspecialty Day. I love Retina Subspecialty Day. So my question for you is planning this. This must be like a huge undertaking. How do you do it? What is it like to plan this? And why is it so important for our community?
Yeah, so great questions. So I've been on the program committee for about 4 years, and during those 4 years, every Tuesday evening, myself and Anne Lestrange, who's been key to this, and my 3 other program directors met
every Tuesday?
Every Tuesday evening for about a year. And it was quite a process to put together the topics, the faculty, gather the feedback from previous years, and not only formal feedback, but of course the informal feedback that we hear from our colleagues. And then we had to decide, are we going to do anything new this year? And so they were the basic, sort of building blocks. And Anne would always keep us, on track for our Tuesday evening. So I apologize, Brittni, if I haven't been able to make any of your commitments on Tuesday evenings, but with all the teaching that you do,
it all makes sense.
So now it makes sense,
Yeah.
right? Where I've been and what I've been doing. So yes, it takes a very long time. Now the other thing is, we had to decide, what to do. And one of the new things that we added this year is perspectives from other specialties, because as retina specialists, we tend to go to retina meetings a lot, but maybe there are updates with neuro-ophthalmology or cataract surgery that it's really important that we know them. So we actually brought in experts for a synthesized talk in various other specialties as well.
This podcast is particularly fun because I think for one of the first times we're talking about our recent Academy meeting, and the unique position you have in recently helping to lead the Retinal Sub Day, for me highlights the importance of how much Sub Days become a critical, if not for some people, the most valuable aspects of going to the Academy. For my journey 25 years ago, the meeting was the most important part, and the sub days were a little bit of a smaller venue. Can you speak to just as you just led this massive retina meeting, sub day meeting, can you just talk about how valuable sub days have become at the Academy? Because it seems like now
it's really important for the retina community,
and it's a
really
very
is.
Huge draw for the Academy to have strong sub days. But comment on that, because in the leadership journey, I would imagine your perspective is valued in that.
Yeah. So to tell you how valuable it is, I mean, we had almost 4,000 attendees. So that really speaks volumes. So as you know, there are a lot of meetings in retina, and every meeting has its flavor and its purpose. And some meetings are more abstract-based, some case-based. But if you're going to go to one meeting a year, you want that meeting to be highly curated, with every topic covered. But yet you also want to have a place for new innovations as well. And so we very thoughtfully pick the topics, make sure that there isn't any overlap. And we had a place for what we call the late breakers, where people can submit, abstracts, so that we can really hear the latest data. And so when people come, it's almost like a course that they're going on. And I think that that's what's important, that you have speakers who are acknowledged to be experts in their field. You have the talks curated, but you also have a mix of panels and debates and new innovations as well. So I think that's why it's so popular.
4,000 attendees.
Was that the biggest meeting so far? Is that for Sub-Day?
I think so.
Do you have any, my appreciation of Sub-Day is it allows the specialists to go and showcase what's new in the field and what's coming, but it also allows people that are attending the meeting that are not retina specialists, or for my case as a pediatric ophthalmologist, in PEDS days when we've had them on, that you allow the either trainees or comprehensive individuals to come and experience what's going on in the specialties. Any appreciation for how many of the 4,000 were core retina specialists versus broader AAO community?
That's a great question. I certainly don't know the numbers, but we can certainly dig in. But we do have a system at the Academy such that when you register for one subspecialty day, you can roam freely between the others. And I think that highlights how important it is to plan your journey into AAO, because it can be quite overwhelming.
Yeah, that's important to remember. Thanks for sharing that. So every year has a theme, correct? So the theme this year was Bright Ideas, Bold Discoveries. Is that accurate?
Yes. So, we chose that theme
How did you choose that?
very deliberately. And what we wanted to do was reflect the creativity that's going on in our field. We wanted to reflect the innovation. But also we wanted to reflect the bold discoveries, what's coming out of the masses of data that we have in our field. And as you know, when we get new discoveries, when we get new data, it can really challenge some of the existing paradigms we have. And so that was why we chose it. And hopefully the meeting reflected the title well. What did you think, Brittni?
I loved it. Yeah.
Okay, for both of you, but for you as a leader, I just would say, as someone who didn't get to attend, I was international at the time, but from a scientific perspective, what areas stood out in retina that you were, excited to hear about at Sub-Day this year?
So in retina, we're constantly looking not just for therapies, but for cures. Okay, and now we might be somewhere in the future between a therapy and a cure. And a cure is what I define as a one-time treatment that's done. And I think collectively as retina specialists, we are looking to reduce the treatment burden for patients. And so there was a lot of discussion about sustained release drug delivery, about gene therapy, and how we're going to incorporate those into our treatment paradigms. How often we're going to see these patients, how often, and how are we going to image them now? There's also discussion about imaging. Imaging is on two ends. One side is multimodal imaging, getting more precision imaging, more AI. And then on another side is AI-driven home monitoring as well. And obviously there's a role for both, and it's typically a combination of they'll come into clinic and get the multimodal imaging, and then in between, get some home OCT, which we're all still waiting on coming into practice, but hopefully soon.
Okay, so I need to, as a non-retina specialist, so you have your breakfast, you go check your OCT, it gives you values on how fluid-filled your retina is, and then you decide how quickly to schedule your anti-VEGF, or what do you monitor at home, and how does it change a person's care? Like, what would be that concept? Because I think it's fascinating, but where might that go?
You've just asked the $1 million question, Eric. This is what we debate. This is what we discuss, over retina breakfast, lunch, and dinner. How are we going to do this, right? We have data. Do I, as a physician, want to be pinged for every change in fluid? Or am I going to set a threshold for a certain patient? And then are we going to treat continuously and extend therapies? Or are we going to treat as needed? There is so much, and I think we'll try things, we'll pivot, we'll change things, and we'll see where the field takes us.
So there was a lot of exciting innovations at AAO 2025. So maybe one or two, could you maybe share with everyone what you think is really going to be a game changer for the next year, the next 12 months. What do you think is going to change practice?
Yeah, so really great questions. I think we've got a lot of clinical trial data coming out in the next 12 months. And that's going to include some of the medium-term delivery for anti-VEGFs and beyond. And so there's going to be discussion about how to incorporate a 9-month implant, a 12-month implant into your treatment paradigm. I presented on MACTEL, which it used to be thought of primarily as a vascular disease, but now I think increasingly we're recognizing it as a neurodegenerative disease. We talked about how imaging has come, how there's better phenotyping, and recently a drug delivery device was approved as well. And so many retina specialists are now incorporating that into their practice. So we talked about that. Certainly in your field, as you know, of retinal degenerative diseases, there are a lot of exciting trials. Many are early, but many are later stage. And there's just a lot that we're looking forward to, quite frankly.
Okay, I need to ask another non-retina question. Remind me what MACTEL is and how that fits, and why. What was important about the clinical trial results you presented this year?
So MACTEL used to be known as juxtafoveal telangiectasia. You may remember that from the BCSC books. Now it's abbreviated as MACTEL, but we talked about the journey as to how these trials became possible. We talked about the family that funded these trials, the think tank that was behind the natural history trial that was able to bring us phenotyping and genotyping. And then we talked about the ciliary neurotrophic factor, and that's and its importance in preventing further retinal degeneration. The other thing that is interesting about the trial is that the endpoint was based on anatomy. It was based on slowing down the ellipsoid zone layer of the OCT and preventing further deterioration of the anatomy. And there were other endpoints as well. But they certainly weren't the traditional, black on white visual acuity. And that tells you that we're really looking to prevent disease progression and identify disease and treat at an earlier stage before the traditional black on white Snellen visual acuity is affected.
Okay.
Maybe for the listeners, can you share how that implant is done?
Yes, so it is a surgical procedure. We participated here in the phase 3 clinical trial, and once the implant is delivered to us in the operating room, it's a small incision, and we place the implant, and it hangs from a sclerotomy, much like other implants that we've done in retina and in uveitis. And it then releases the neurotrophic factors. Obviously, we have to close this incision, very carefully, close the sclera, the conjunctiva, overlying
There are living
it.
cells inside the implant.
But yes, there are cells inside the implant. They're released. And it is said, from previous implants that have been explanted, that it may be active for, 14 to 15 years, which is pretty exciting.
Mm.
Talking about just leadership, so you shared about this journey of the length of time and the investment in weekly calls to put together a sub-day. Those listeners out there that have been in their own specialties involved in meeting planning can appreciate how challenging that is to, get a theme, fill it out, make it attractive, cutting edge, innovative. Talk about the leadership journey, could you? Because we value you as a leader for our department, but when you lead a nationwide effort of gathering input, I'm sure there's a lot of opinions, a lot of ideas, and a lot of decision making that has to go in. Talk about the leadership journey and behind the scenes of taking it from let's develop something that has bright ideas and bold discoveries to opening morning.
Okay. That's a great question. So as you know, change is one of the most difficult things of leadership. And the easy thing would have been to just show up on the calls and say, well, what did it look like last year? Okay, these speakers look great. Oh, this guy can't make it. She can't make it. Let's just replace those two people. That's the easiest thing to do, is get a template and follow it. But we certainly looked at the template. We took the feedback into account, and there were a few things that we wanted to change. One of the things is really looking at the contributions of individuals. We didn't want somebody speaking more than once. So you couldn't be a moderator and have a talk and maybe submit a late breaker as well. Okay. So there were people that we saved for late breakers because they usually, submit. And some of them were reaching out saying, well, I usually get invited. Why wasn't I invited? And we said, well, we're saving you for a late breaker. You always have something great to submit, at the last minute. There was also diversity of thought and opinion that we need to bring in. And so that means bringing in new people, really scouting out, who the emerging talent is, people who perhaps, younger or haven't spoken before, and getting them involved into the program. But that also means that some people who are used to being on the program every year may not be on this year. And it doesn't mean that they're kicked off the program. It just means that we have a very broad faculty, and we're deciding, which talks to include, who to rotate off, who to bring in. And obviously that can be difficult for some people who are used to delivering a similar talk every year. So the change management, I think, and navigating those conversations with people was definitely tough. I had, 3 wonderful co-program directors, and they were always bringing in ideas, giving feedback, letting us know about a talk that they heard recently, perhaps at an international meeting by somebody. And, you should, think about this person, for example. So we're definitely open to new perspectives and new ideas.
I had another question about the meeting itself.
Go for it.
So we did that's the prep, gathering ideas.
Can I thank Dr. Bakri one second?
Yes.
So I was able to speak at Retina Sub Day this year, and so thank you to the program, committee, and for allowing people like myself who are early career to speak. But when I was given the opportunity, the program team said, what are some of the topics that you feel like would be really meaningful in the space, and give us your top few. And I think they reviewed them and said, okay, I think this would make sense for the program. And so I went through the last few sub days, the last few years, and I picked a topic that had never been presented before, and it was chosen. It was, I think, very well received. But thank you for giving a new topic a chance to be on that stage. And me as a new, vitreoretinal surgeon, it was a really good experience.
Well, thank you for agreeing. Thank you for participating and giving, a great lecture. And as I shared with you, what we really want is, we want where science meets the clinical practice, right? We want physicians to be sitting there going, I learned something, that's my take-home nugget.
And it was practical.
I will implement this either next week, or I will table this for 6 months when, this drug, comes into my hands. And really that's what we want. We don't want anything esoteric. We don't want anything that's too early phase, but we want real clinical pearls and nuggets. So thank you.
Yeah. All right,
one of my I was going to say, we talked about the prep, and then morning of, one of the challenges when you organize meetings is stay on time, stay on task. I just was at a meeting where the presenter mode gave you an alert when you had 30 seconds left to wrap up, or a minute left. And then it got a red alert for the last 15 seconds, and then it shut off the mic.
Oh.
And then it turned it back on for 30 more seconds, so you could get a little more. I think one of the hard parts is when you design a meeting is you want to have enough presentation time complemented by enough discussion time, but actually stay on time. Comments on that from what you've learned as you advise people planning meetings in terms of that balance?
Yeah. So I've learned the hard way. I've had the black screen. It hurts dramatically. Luckily, it was early on in my career that I had time to rectify that. So no, we did not have a black screen. But one of the good things about Subspecialty Day is that we're able to involve trainees. And we have several trainee volunteers who sit there in the front row and run those timers so that they give the speaker that 1 minute, that 30-second, heads up. And I have to say that there are speakers that are renowned for going over, and we went and talked to them personally beforehand that, this year, please make a real effort, in that. Because, they didn't need the extra feedback, that they know it, they've heard it before. But really important to keep things going. The other thing we had is really long discussion times. And so I would say there's a few minutes fluff in there if we really go over time. But the feedback that we've had is that attendees love discussion. And they also love debates. And debates is another section that we prepared.
You commented earlier about how this year you made an intentional effort to make sure part of Subday included other specialty topics that interfaced, that complemented with the retina program. Comment on that, or how did that go, and what was your feedback?
So the feedback I had is that it went really well. I mean, if you look at the demographics of most of the attendees from Retina Subspecialty Day, they learned how you manage glaucoma, neuroophthalmology, years ago, if not decades ago, right? Sometimes you just want that overview, what imaging do we recommend now for a glaucoma patient, right? What are the latest drugs? Tell me quickly, briefly, what is your treatment paradigm? You go from A to B, or do you do A and then add B? And then, if you look at the space of intraocular lenses and what's changed, when I trained, it was plain lenses and torics. And now, wow, the extended depth of focus, the multifocals. I mean, the menu is huge. And, I learn a lot by being at Mayo Clinic and speaking to my colleagues every day when we share patients, and they may share or, ask me a question about, what lens to put in, or, how we're going to integrate glaucoma management into the retina plan. So I learn every day anyway. But I have to say, sitting there and getting a didactic overview it was just invaluable.
Wonderful.
So we've talked a lot about the programming of Subday and these lectures, and wonderful program. I very much enjoyed it. Can we talk a little bit about the networking and the social aspects of AAO, and specifically the sessions that maybe help people with, decisions in life and getting a job and having mentors? Maybe speak to that a little bit.
So Retina Subspecialty Day, as you know, is very session heavy, but there are breakfasts, breaks, lunches, and receptions that are associated with it that many people come to, and that's where the informal networking goes on. There are a lot of fellows that are there with their mentors, residents who are there with their mentors, and of course that's an opportunity to meet other people in the field. So you always have that sort of informal networking, which is super important. Beyond that, there's a lot of formal networking sessions set not just by Retina Subspecialty Day or any subspecialty day, but really by the Academy. The young ophthalmologists in particular have had a very large investment. They have YO networking events and lounges. And there are sessions for ophthalmologists at all stages of life. Whether they're graduating from training, whether they're considering, retirement and the next phase. There are sessions on, financial decision making. The thing with the Academy, though, it is vast, it's huge, and one has to comb through the program very carefully, probably weeks before you go there, and really set up a plan, because sometimes these sessions are concurrent with other sessions you might want to go to as well.
Well, that brings up in terms of tips. So you brought up the Yo's. It is intimidating to and exciting to go to Academy the first time as a young ophthalmologist, a trainee. What advice would you have for someone heading to the Academy the first time, whether they make the Retina Day or not? How do you help them package approach the meeting to have success?
Yeah. So I think at whatever stage you're at, you really have to have a goal in mind. You can go and you can sit there and you can roam from room to room, but I think that's highly ineffective. So what is your goal? And it's a combination of many things. Who would you like to meet? Who would you like to network with? Are there any courses in particular you want to attend because you are currently learning a new skill, right? So many courses at the Academy, so many wet labs. So I think you have to have a goal in mind. You have to go through the program, and you have to set up your itinerary for navigating the program. Remember also, there's a humongous exhibition hall, a lot of partners from industry, and you want to meet with them because maybe there is a new piece of equipment that you want to bring and integrate into your practice. Maybe there's a new clinical trial that you want to bring in. So many opportunities, to partner with ophthalmologists and industry partners. But again, I think you have to have a goal and a purpose, just like anything that you do. And I think if you do that, yes, it's going to be an exhausting meeting, but it's going to be a very fruitful, productive meeting as well.
Mm-hmm.
Okay.
I
From a leadership standpoint, are there any, I don't know, surprises or lessons that you would want to share with someone who's about to take over or about to be in leadership at their specific meeting? I'm sure you've learned a lot over the last few years.
Yeah, I would first of all say that, making any change is always, harder than you think it might be. Mm-hmm. So I think it's important to listen to people, to get feedback. There are always people who have different opinions, right? And what's hard is, balancing out the opinions. So one opinion might be, this meeting was great, don't change a thing, keep it the same every year. And another opinion might be, we need new people in this. We need some new perspectives, right? And then you have to kind of balance both. You have to balance the tried and tested, those that will come. They're going to deliver a great, a great talk. It's going to be well accepted. It's going to be loved, with giving people an opportunity, and maybe taking a little bit of a risk on some people. Now, I would say the program directors are going to take less risk if, when they bring on the new people, they tell them various things like, for example, for me this year it was, let's be on time, but let's keep the talk clinically relevant. I don't want anything esoteric. I want people to take home valuable nuggets. So I think having those one-to-one conversations and helping mentor the new people is really going to help elevate the program.
I really appreciate this time connecting with you. One of the things you touched on earlier was this connectivity. I missed AAO this year because I was international, but I will admit the thing that I so valued, I've always valued about Academy, and I think what is in the sub-day probably is a microcosm of that, is this connectivity of like-minded passions, interests, perspectives towards our goal of caring for patients better. Can you speak to just, when you think back over your career, meetings like Academy or your subspecialty days, what brings excitement for you to go? I know it's work, I know your strategy to kind of what do I want to get out of it, but what are the joys when you look back over, when you fly home, saying what parts of Academy, what parts of your meetings do you appreciate most?
Yeah. So the parts that I appreciate most, it's really about the networking and learning new things. In general, I'm a curious person. Mm-hmm. And when I listen to a talk and I learn something new, typically I take notes, on my phone or whatever piece of paper I happen to have. And I bring them back. And the first thing we do is, when we're in our retina hallway, discuss it with my colleagues. Did you hear that talk by so-and-so? What do you think of this device? Do you think it's worth bringing in to try? What do you think about that trial that's coming? Should we be enrolling patients as well? So those conversations, when I first get back home, I think are really exciting. I think the networking is great. We have amazing colleagues in retina and ophthalmology and industry, and everybody brings something to the table. The other thing that I like about AAO is networking with our alumni. The people that we've trained in our training programs that have gone off to do great things, and getting those updates about how they're contributing to their community, their science, their institutions. And that's always very inspiring to see the impact that we have made, on the upcoming generation, and really to follow their progress.
I want to shift gears for my last question, if that's okay. So, hearing your introduction, you've done so much and such meaningful work. And I know as our chair, we're all really happy that you're in leadership. You've just been amazing to work with and to be mentored by and to work alongside. So with that said, on a personal level, you've done all of this. You were on the program committee. You are on all of these editorial boards, and we're impressed by you. But my question is, what's motivating you at this stage in your career? Thank you for what you do, but talk us through. What's your motivation?
Yeah. So at every stage of my career, I've had, I think, a different motivation. I will say that, unlike a lot of people, I haven't actually planned everything the way I ask my mentees to plan what they're going to do next. I have to say, it's kind of been a little organic. For example, when I started, my goal those first few years was to just be the best clinician I could, do research, do clinical trials, really get my feet wet with everything. And then I also, at the same time, when I saw some inefficiencies and things, I was definitely passionate about systems improvement and quality improvement. And so, I got into that, and I think, people recognized that I was able to make changes, and most likely that's why I got asked to dig further into leadership. But I've loved everything that I've done, from, reviewing papers. I mean, what does reviewing papers do? It adds quality to the literature that we read, and it sifts out the things that are just not done right and lead to the wrong conclusion, for example, right? Research, obviously, that answers questions that we wouldn't otherwise have the answers to, so I think that's super important. But at this stage now, what I love doing is making an impact. And making an impact, I know it's a broad term, but when I look at the young people that we bring in and we hire, or even the mid-career people that are looking to change, trajectory, you say, well, why are they coming here? What can I do to help them? What resources can we give, to help them? And that's an impact beyond what I can do alone, right? As I look at things that we can do for our department and for Mayo Clinic, again, it's setting up systems and processes that are going to outlive any one of us. And as you know, I'm super excited about the direction that we're going in, Mayo Clinic with AI and the digital health and, our Opus network. Again, it's just the next, frontier. So I think that's what motivates me right now. It is different. I still love to do what I previously did. But again, if I can give those opportunities to others who are starting at that phase in their career, I think I can make a bigger impact at this stage. I've learned a lot through leadership, and one of them is, mentoring and also delegating as well. So,
well, I think the success of the Retina Day speaks to, I think, what we get to experience daily in our department is that, we appreciate your leadership in raising up others and being collaborative and bringing in new ideas, and just in that mentorship connecting role, kind of vaulting and elevating what we do for better impact, whether on a national scale at a retinal meeting or here at home at Mayo Clinic. So thank you for being our guest again, because we love having you here on the podcast.
Oh, thank you very much. And, I will just add that I have appreciated working with individuals who are engaged and motivated and share the same mission and passion, that I do, that it's ultimately about patient care. But how we improve patient care is by the research, the quality, the leadership, the sustainability. And when I get to work with amazing individuals, that really makes every day of mine just worth living and worth coming to. So thank you.
Thank you, Dr. Bakri.
You can find all episodes of the Mayo Clinic Ophthalmology Podcast on our website, YouTube, or on most podcast platforms.
Thank you for listening, and we definitely look forward to sharing more on our next podcast.